Okay, good morning and welcome to CHCCCS011 Meet Personal Support Needs. So today we're going to be going through and reviewing the individual plan and what we're going to have in that plan to meet our clients' personal support needs. So we're going to be looking at their personal hygiene and appearance, their dressing, their living, their meals, and medication and any other care that they may need. So we need to identify requirements outside of the scope of your own role and seek support where needed. So this means that if you've been asked to do something that is outside your job description or outside your scope of knowledge, you need to go and ask your supervisor. In the meantime, what you can do are the following. So you can assist with personal hygiene, hydration and nutrition, maintain of good skin integrity and pressure area prevention, mobility and transfer, including in and out of vehicles and fall recovery techniques. You can monitor nail care, pain, rest, sleep, respiration, and any technical care activities. Impact and effect of support. So when you're providing support, it can have a negative impact as well as a positive one. So negative effects may include embarrassment, fear, making jokes of, disempowerment or humiliation. Consider specific cultural needs of the person. So we need to conduct ourselves in a culturally appropriate way. So when we're attending people's personal hygiene needs, we need to take into account the client's personal needs. Whilst we're attending to their personal care needs, we need to ensure that we're also attending to their cultural needs. So this is by maintaining dignity wherever possible. Consider specific physical and sensory needs of the person. So here we're going to use our tools and equipment. So whether our client needs a pixel hoist, which is a stand-up hoist, or a full sling hoist, whether they are 1 or 2 assist, whether they use a wheelchair or a commode or a shower chair, we need to take all those things into consideration whilst we're attending to their personal needs. Assist with specific daily tasks, or ADLs as we call them in the industry. So this can be things from showering, shaving, dressing and undressing, any toileting or continence issues. It could be eating, drinking, or gaining the modified cutlery for them to do so themselves. It could be the mobility and transfer, as I've mentioned previously, using hoists, slide sheets, wheelchairs, wheelie walkers, anything that they need to help them get around a bit easier. So we need to talk about some risks. So there's several risks posed to both the client and the caregiver within the care industry. These can be anything from slips, trips and falls as a WHS risk, up to the dignity of risk for your client. Client preferences. So we need to take into consideration what our clients prefer. Do they prefer to have a shower in the morning or in the evening? Do they prefer to have their hair washed 2, 3, 4 times a week or every day? Do they use an electric razor or a normal razor? We need to take these things into consideration when we're attending to personal care needs. Confirming procedures. So this is what we're going to go through and discuss with our client prior to us doing it. So if I came into a client's room and I introduced myself, I'm going to let them know that I'm going to get them up and we're going to go and have a shower. I'm going to provide them choices on what clothing they would like to wear, and I'm going to be communicating with the client throughout the entire process so they know what's going to be happening next. Client participation. So this is where they're making decisions about their own care or about what they want to do in their day. So they might refuse to have a shower this morning because they had a shower last night for a certain reason and it's cold, so they're going to refuse, and they have the right to refuse. They also have the right to be able to change their mind at any time. They might want to have their hair washed on a certain day that they don't usually get it washed, and that's okay too. We just need to adapt to what the client wants. Providing information. So in order to understand their condition and make the best decisions for themselves, clients need to access information about their care needs and health requirements. So this is where we sit down with the client and we talk to them about what needs they need to put in place to be able to have a good well-being, a sense of belonging, and to be able to get through each day as easy as possible. Using equipment safely. So there's many aids and equipment that we can use throughout this industry, and to use it safely you need to gain the appropriate training to do so. Now the equipment could change from one organisation to another, but we do provide manual handling, which is where we take you through with the trainers and we show you some equipment that's used in the industry. But we also do remind you that when you do go out into a particular organisation, they will take you through how to use their specific equipment as well. So technical care. So these are simple things like dressing or catheter care. It doesn't include the insertion or removal of a catheter though, it's just the care of the site. Application of prosthetic legs, arms, hands. Application of antithrombotic stockings, so this is what we call TED stockings that we use in the bottom part of the leg for our clients, and assistance with breathing tubes. So this could be anything from a Hudson mask to a nasal prong mask that we'd be using to take on and off whilst we're dressing. Encountering problems with care. So sometimes you'll come across a few issues whilst caring for someone. It could be that their behaviour, it could be that they're refusing. So what do? Once again, take it to your supervisor and go under his or her direction. Changing needs. So changing to the client's personal care requirements can relate to sensory difficulties, mobility issues, any new conditions that they're experiencing, any injuries, it could be from a fall, any ongoing illnesses that they're having, health concerns. You may identify health concerns related to individual clients through the course of your work. So what do? Take it to your supervisor. If you see any changes or decline in any of your clients, you need to inform your supervisor immediately. Personal support. Maintain confidentiality, privacy and dignity of the person. So of course, whilst we're giving personal care needs with our showering, our toileting, our maintaining the hygiene of the client, we want to do this with as much dignity and respect as possible. So what do? We ensure that we knock on the door before we enter, we close the door whilst we're in there attending to their services, we make sure the curtains are drawn, and we maintain their dignity in the best possible way we can. You will see that you've got a list of questions that you go through for this unit. They will consist of skills assessment, knowledge assessment and a performance assessment. You will find that there's also work placement hours attached to this unit that will need to be given demonstrations through your work placement and be observed by your trainer or your buddy. If you have any inquiries about what these hours include and what you need to do, please feel free to get in contact with your trainer and he or she will be more than happy to go through it with you. Thanks for joining me again, guys. Bye.